Uganda's progress in tackling HIV is under threat from increasing drug resistance. The government and NGOs say the problem is particularly acute in rural areas which experience medical shortages. As Leon Ssenyange reports, a lack of access to antiretrovirals and the stigma attached to taking them is believed to be fueling the resistance that's threatening efforts in fighting the epidemic.
Singing against stigma, Moses Nsuga is part of a group dedicated to tackling discrimination faced by Ugandans with HIV. He says when he was first diagnosed over 20 years ago, he often failed to take his antiretroviral drugs.
And when I started treatment in 1998, I did not take it well because I did not know the importance of adherence. So as a result, I developed HIV drug resistance in the year 2000. So I faced it so rough, I fell sick, I nearly died.
As a musician, Nsuga is now part of a campaign push in Uganda for greater HIV drug adherence aimed at reducing the stigma surrounding the virus.
Most young people who fail think that they are the only one taking the medications. But when they see Stigmaless, they get changed. So I formed the Stigmaless as a way of communicating to fellow people that it's important to take medications every day.
It's estimated 1.3 million people live with HIV in Uganda. But while more than 70% are enrolled on antiretroviral treatment, drug resistance continues to plague efforts to combat its spread. A 2018 study by the Uganda Virus Research Institute showed that there's a gradual increase in access to treatment by people living with HIV. However, such strides are facing a drawback, with 2 in every 10 resistant to antiretroviral drugs. Researchers blame the resistance on the lack of adherence to drug regimens prompted by poor access to drugs, as well as the stigma associated with taking them. Resistance is especially prevalent among mothers, children, and adolescents.
Every time you miss out your drugs, there's a window for the virus to mutate, as I said, to change into a form that will be resistant. And once that happens, much of the gains that we have got are going to be reversed.
Health officials say drug-resistant patients are switched to different drug regimens, but the medication can be very expensive and only available in small quantities. The government says it's looking for alternatives.
In the last 1 year, we have been working out what is the best treatment approach for a country that will give us maximum impact. And we have been looking at all the drugs, and there's a new drug which has come in, which you must have heard about, which is called dolutegravir, which we are now introducing in the treatment regimens as our first line for adults.
HIV infection rates have steadily declined over the last decade in Uganda, with a dramatic scaling up in treatment programs. The Uganda government says, despite recent setbacks, it wants to capitalize on that progress by encouraging more testing and treatment, behavior change, and eliminating mother-to-child transmission. Leon Ssenyange, CGTN, Kampala, Uganda.